Don't you guys ever wish that, that aching back pain or, oh, those knees are the joints that are killing you? Don't you just wish there was a way that you could repair it without, chemicals and drugs? There is a way at Advocate Integrated Medicine here in Johnson City. And I am with Dr. Tim and Michelle. And, you guys have got something new that you've brought to Johnson City. Can you explain to everybody a little bit about what this is?
We do have something new, and it's about keeping the joints that you currently have. Let's not get replacements because the new parts are not the same as the old parts.
That makes sense.
Yeah, so it's a way of taking your old parts and regenerating them and rebuilding them and refreshing them so that you can get back to the life that you want.
That's what happens to Superman and Wonder Woman. I had to say that, right?
Exactly.
But how do you go about doing that?
Well, we use a diagnostic ultrasound. We use x-rays. We find out exactly how the joint is functioning. And then from there, after our assessment, we have a team of providers. So we have a medical doctor and a nurse practitioner and chiropractors and therapists. We all sit down every morning and we assess the patient and see what the best plan of care is going to be. And in this particular case, we use mesenchymal stem cells. So we inject the joint, then we brace the joint to unload it, and then we rehab the joint, and it regenerates the joint's cartilage.
So how long does that take? You guys got to send it out? What do you have to do? How long does it take to do that?
The injection is the same day.
Really?
So you can take the x-rays. The next day we'll bring you back in. We're going to look at all of your test results. And if that is your plan of care, then it's simply exactly where you're at now. Patient sits on the table. Our nurse practitioner has the ultrasound in one hand and the injection in the other. Uh-huh. So that way we know exactly where the tip of the needle is going, where these stem cells are being deposited. And then from there we inject it. And then it's just a matter of doing rehab with it.
So I'm instantly starting to re-heal and repair, right?
So what we found is like within a week, 10 days, you're able to go up and down stairs with a reduced pain levels. Okay. By 2 months, you're able to go to the gym and do some squats, some full range of motion. And typically by 90 to 120 days, you're kind of back to the way that you need to be.
Really? I've heard about this, but I didn't know anybody was doing it here in Johnson City.
No one's doing it in Johnson City. So
you guys are, right? You're the first to bring it here.
Yeah,
right?
First one's here.
Nice.
Yeah.
So you do have a team, like he was saying, right?
Yes, we do. We have a medical doctor, and we have a nurse practitioner, Kim Lilly.
Okay.
And then we have our in-office staff, which is our case manager and his wife, Dr. Cindy. And then we have Lynette, who is our front office. And I just get to do a little bit of marketing and help him spread the word about what we're doing here and getting people here.
Fantastic, because I've heard this is the newest, most innovative thing going on right now, and I thought it would be years before it came here. Thank you so much for bringing it.
So think of it this way: if you were to have a typical degenerative joint, which I have in my knees, the typical plan is that over-the-counter NSAIDs followed by some cortisone injections.
Yes.
Which you can only have a couple of those because it deteriorates the joint. And then from there, then you're getting in line for a joint replacement.
Okay.
So how many joint replacements can you have? You can only have 2 in a lifetime. So each step, your body is degenerating that joint. You're trying to minimize it, but it's still degenerating. So we haven't talked about how much time off work does that process take?
Yeah.
How long is the rehab? What's the rehab like and the pain that you're still going through? This is not a procedure that's covered by insurances, so everyone needs to know that. But you have to remember that the cost of a joint replacement, the out-of-pocket cost, is typically what we're going to be paying for this procedure. Wow. Yet you don't have the downtime. Your life isn't restricted.
And the pain.
And the pain.
And all the chemicals going into your body.
Yes.
Exactly.
No
because
medication.
these are tissues.
Right.
So we're simply transplanting the tissues from a prime source, a full live term healthy fetus. The umbilical cord is where we're getting the Wharton's jelly from.
Gotcha. I know people have had some different opinions about that as well, but you all educate people about that kind of stuff, right?
Yes.
Critical, every step. So one of the first things that we want to do is that we want to put patients on a ketogenic based diet.
Okay.
So when I say based is because there's many different types of keto-based diets. So we want to put them on that type of diet in order to reduce the inflammation that's already built up in their body. In other words, let's create an environment so that this procedure works well. You get the maximum benefits. So we want to start patients on that. Then once we get the injections, now we're going to brace it and unload it, and which means takes the stress off the cartilage so that it has a chance to regenerate. And then we want to add chiropractic and massage and physical therapy so that we can strengthen the joint and get it functioning correctly.
You know, you are the one that taught me, believe it or not, and I listened about what we put in our bodies is what comes out. You are what you eat. You had told me that. So here I am drinking all these Pepsi Colas and these Mountain Dews and things that were hurting me, and I didn't realize it. A drink's a drink. Yes. It's on the market. And you showed me how much sugar I was taking in and what the carbonation was doing to my body. And so I see why a diet is so important to heal. Listen. You guys have got to listen. What he's doing here is amazing. What do they got to do?
It's not really a diet. It's a lifestyle change.
It's a lifestyle. Exactly. That's what it had to be for me.
This is a complete lifestyle
I had
change.
to hear from somebody that knew that before he could make me understand, because you can read it all day long, but when he made me understand, and it went me go, I've not had a soda since I met you, 5 years ago.
Wow.
Look at that. Did you know that?
Wow, that's impressive.
That's awesome.
That's impressive.
Kidding. But how do they come and talk to you? What's the first step?
That would be Michelle.
They can call me. Of course, we're on social media. Definitely Facebook, Instagram, anywhere. Email. We have a website, advocateintegratedmedicine.com. But if they want to come into any of our events that are coming up, and we have some coming up, they can call me directly at my cell, 423-557-3888. Make sure I got that right. 557-3888. And I will get them set up and get them educated. And I think just talking to the people that I've talked to the past few days, that's what they're asking me, is those kind of questions we're talking about. Because a lot of people do not understand exactly what that is, or what the regenerative piece is. Why does it say in regenerative medicine?
So let's get the answers.
Yes.
Let's ask the questions. Let's get the answers. So when patients come in, we want to do a full assessment to find out if this is your best choice. And then we want to look at all the choices and we want to lay them out on the table. Much the same with our kids that are going to college, right? You want to find out what their interests are, then you want to lay all the choices out and then make the most appropriate choice for them. Healthcare is the same thing. So healthcare is about restoring function. It's not about eliminating symptoms. And our healthcare system is 85% chronic disease. And chronic disease means that it ramps up over time. So what we're doing here is primarily arthritic or degenerative joints, and it's a way to regenerate. So we don't look at it as a treatment or a procedure. It's a way to regenerate the cartilage that's been breaking down.
So if those are out suffering, what are they suffering from that they should come see you about?
Trying to go up and down stairs and it hurts. Old athletic injuries to a shoulder, those types of things. So we're looking at just about any joint with the exception of spine.
Gotcha.
We haven't got to the point where we can look at these procedures for spine. Not to say it's not being investigated. So we're looking at ankles, knees, hips, shoulders. Exactly. So one, you got to reduce the inflammation, and then you got to regenerate some of this cartilage that we had that's been degenerative, and then we need to rehab it and stabilize it and strengthen it. It's all about restoring function.
It makes sense when you say it. I can read about it all day long, but when you say it, you tell me the way that I understand it, and I appreciate that. And it's free to come see you guys for consultations. Why not set up an appointment? This is the newest thing going on. If you guys are out there suffering, there's an alternative, and it's Advocate Integrated Medicine.